Good afternoon, everyone, and very warm welcome to all of you present here. I am Shifa Sheikh from Docplexis. As we all know, Docplexis is one of the India's most trusted and first leading digital platform dedicated exclusively for doctors, focused on enabling continuous medical education and professional networking. So, dear users, today I would like to welcome you all for another very interesting session on very important topic on oral nicotine pouches in India, a review of online availability, marketing, public health, and regulatory issues. So, for this wonderful session, it's my absolute pleasure to introduce our esteemed speaker for today's session, Dr. Rakesh Gupta. He is President and Director of Public Health Strategic Institute for Public Health Education and Research. Along with him, I would also like to invite Ms. Tuisha Mahajan, intern with Sipher, and Jatina, the technical officer at RTC, RCT,
RCTC.
yeah, PGI Chandigarh. So without further delay, I would like to hand over the session to Dr. Rakesh. Over to you, sir.
So thank you, Shifa. Can you show the slides, please?
Yes, sir. Just a second. Let me share.
So some part I'll be covering, and the other part Trisha will be covering from the slides. So I'll be covering the introduction and the conclusion recommendations part.
Yeah, my slide is visible, sir.
Yeah, it is visible. Yeah. So the abstract at a glance is the background that contains the oral nicotine pouches are tobacco free. They are non-combustible nicotine products, and that has expanded rapidly worldwide since 2016, and they are now sold in India despite available regulatory provisions. We already have some regulatory provisions in India, and the objective of the study is that this review that synthesizes evidence of uh, ONP's oral nicotine pouches, its online availability, marketing practices, regulatory status, and public health response, situating the Indian market within the global evidence base. Now, actually, we are doing a study of physical availability also, but that is with a different in term. The methods are that regulatory notifications, health advisories, and peer reviewed literature were reviewed alongside the direct surveillance of e-commerce platforms and the social media. And what our findings are that ONPs they remain widely accessible in India through e-commerce channels and social media promoters, raising concerns regarding youth exposure and access. And the concluding part is that a meaningful share of the evidence is industry funded, uh, and that has to be ignored actually. But it supports urgent clarification on ONP's legal status and closer monitoring of the e-commerce media and social media sites is required for youth surveillance. Next, please. The background of what are the oral nicotine pouches? They are tobacco free, but they are not risk free. They are the small pre portioned pouches placed between the gums and lips. Nicotine is absorbed without combustion or spitting. So, Trisha, I think you must show some nicotine pouches also in the photographs. So nicotine pouches, they are just like they are the size of almost one third of the tea bags, and just they look like tea bags. They contain no processed tobacco leaf. The nicotine is tobacco derived or fully synthetic, and a distinct global strategy since the mid 2010s, dominated by the major brands like Zin and Velo. They are the major brands, and oral nicotine advertising spent overlook in overtook that conventional smokeless tobacco spent by August 2020. So now actually people they are more spending on advertising the nicotine pouches other than smokeless tobacco. India's tobacco laws like COTPA 2003 and the PICA 2019 predate ONPs and do not formally cover them. Next, please. So the objective, they have been already told that the search objectives are mapping the online platforms and e-commerce channels, marketing ONPs in India, and characterize the marketing strategy, messaging, and the target audiences used. examine the India's regulatory framework and compare it with the international approaches, synthesize evidence on health implications with attention to youth vulnerability, document public health advocacy efforts and police responses, and situate India's ONP's landscape within the wider global evidence base. I may tell you that Trisha and Jatina has given very good inputs, and Trisha is still going on with the study. Next, please. And the rationale why the study was done was ONPs they sit in a perceived regulatory blind spot. COTPA 2003 targets tobacco products and PICA 2019 that targets electronic cigarettes. But many ONPs they use synthetic nicotine and they fall outside them. And moreover, they are ingested. They are never smoked. E-commerce and social media, not physical retail, have become the primary least regulated route to market. Then flavored variants and tobacco-free branding are linked to youth appeal, and almost 17% of the use of the U.S. young adults they believe that they are not tobacco-free pouches, but even nicotine at all. They don't contain nicotine at all. So this is the perception of the U.S. young adults, and this may be the perception in India as well. Vendor surveillance for this review that found that ONP is available via online channels as of June 26. Regulatory clarity could still shape the market's trajectory, but we are trying to find out if they are available on shops physically as well. Next, please. And the search gap is that evidence base concentrated in high income, English speaking markets like US, Sweden, and UK. And India's regulatory response documented only in fragments. Isolated state notifications from Tamil Nadu, Haryana, Himachal Pradesh, they are, yeah, and it's not a coordinated policy and not pan India level. And 17 of the 16 studies in the most comprehensive global since they were industry funded. So they can't be relied upon. Next, please. So over to Trisha.
Yes. Am I audible, everyone?
Yes, you are audible.
Okay. So methods basically revolves around how we did our study. And could we go to the next slide, please? Yes. So we drew on regulatory documents, peer-reviewed and grey literature, news coverage, and direct surveillance of e-commerce and online social media, all focused on oral nicotine products, online availability, marketing, and regulatory status in India. We reviewed the literature, including a 2025 global scoping review, and ran targeted searches of Indian government and drug control sites, and manually searched e-commerce and social media platforms using terms like ONPs, oral nicotine products, pouches, nicotine pouches, and snus for sale in India, because oral nicotine pouches are often synonymous with a Swedish type of product which is very similar called snus. And could we go to the next slide, please? Yes. So the timelines in the platform searched. So in this study, the data collection ran from the 12th of June to the 22nd of June. And we looked at English language sources, drew regulatory material from the Ministry of Health, state drug control directorates, and government portals, and covered IndiaMart, Instagram, and independent vendors with their own e-commerce websites. One thing I would like to add to this is that whenever we went to a separate e-commerce website, we always used to look at whether they used to deliver to India and what their policy was like for different nations, because the laws surrounding oral nicotine pouches in different countries are different. So slide 13, please. So these are, now I'll be presenting the results. And next slide, please. Yes. So online availability in India. So we have various domestic and international channels selling oral nicotine pouches to Indian consumers as of 22nd June 2026. Since then, the list may have changed. So we have separate sites like Pouched, Bajaro, Snus for Sale, Azari Ford, Snus Express, and some various vendors on IndiaMart, as well as manufacturers and direct wholesale sellers such as Dhulakia Tobacco selling under the name snuff.co. And then we have 3 Instagram user handles who, instead of directly selling the product, they advertise it and they sell it as a part of their lifestyle, which adds to the marketing aspect of it to appeal to a more youthful audience. Yes. So, and as you can see in the origin of nations, only a handful of them are from India. And from most of the research that I did too, you could see that a majority of them were from Europe, specifically Sweden, because the product found its origins over there before it hit the global market. Okay, so now marketing practices. So tobacco marketing is actually a very interesting field because you see that over time you went from when it was the time of cigarettes, you could see that it was focused towards catering to men specifically, but over time the user base has become much more diverse and so has their product and their packaging. So if you see vapes now and oral nicotine products, they are all very brightly colored and they're advertised as having no tobacco at all. So digital advertising, social media, and lifestyle branding drive promotion and sales, and this is how they became popular in the first place. So tobacco free framing lowers the perceived harm and broadens appeal. And like Sir said earlier, in a study done in the United States, around 17% of young US adults did not know that oral nicotine pouches do contain tobacco because they assume that, oh, if it doesn't contain tobacco, it probably does not contain nicotine, but they don't realize that nicotine can also be derived from can also be synthetically derived. So the target demographics have expanded to include women and younger adults. So now, specifically in the Indian market, although there's a lack of research, so we see that there's emphasis on convenience, discretion, and modern packaging. And there's a wide range of flavors. There's mint, cherry, coffee, fruit, and ice variants. There's so much variety, that there's so much color, and there's so many different flavors you can choose. It's almost like they're selling candy bars, you could say. And they're promoted largely through Instagram, which, as we all know, is where the youth of the world is today, and via influencer style content most of the time. Okay, so now the regulatory framework in India. States in India have begun to be cognizant about the risk that oral nicotine products hold, oral nicotine pouches hold, and 3 separate states have released notifications regarding, raising an alarm for this. So Tamil Nadu, the Directorate of Drugs Control alert in February 2026, Haryana, the Food and Drugs Administration Enforcement Directorate, and Himachal Pradesh, Directorate of Health Safety and Regulation, public notice recommending a ban. So apart from this, we have COTPA and the e-cigarette ban PECA in 2019, but they do not cover oral nicotine products very explicitly, like the PECA Act, Prohibition of Electronic Cigarettes Act. It very specifically targeted e-cigarettes and vapes, but as so far in India, we don't have a law that surrounds only oral nicotine products, a central policy, and we currently rely on the Drugs and Cosmetics Act. Okay. So now coming to the Drugs and Cosmetics Act in 1940, oral nicotine pouches themselves have not been approved as a drug under Section 3B of the Act, which defines a drug as any substance intended to affect the structure or function of the human body. Poisons Act 1919, in several states, including Punjab, Chandigarh, and Haryana, nicotine has been classified separately as a poison, meaning that manufacturing or selling any nicotine-containing product in these jurisdictions requires a license under the Poisons Act. Now, the FSSAI, the Food Administration of India, states that any food or ingestible product should not have tobacco or nicotine under Section 234. And the Bharatiya Nyaya Samhita under the BNS, Section 123, deals with causing hurt using poison or drugs with intent to commit an offense, while Section 275 addresses the public health offense of selling noxious or spoiled food and drinks. So the international regulatory landscape. So India is not isolated in this problem of regulating oral nicotine pouches. Every 5 or 10 years, a new nicotine containing product comes around, and it's very difficult for the government to keep up with the youth. So the international regulatory landscape, it's worth seeing India's uncertainty in context because we're not alone in this. Finland, Spain, and Australia regulate synthetic nicotine pouches as medicine. The Netherlands, Belgium, and Singapore have banned them or are moving to ban them. France went further in 2025 and banned production, distribution, and use outright nationwide. Germany and Sweden treat them as an ordinary consumer product, which I as I stated before, Sweden was the birthplace of this product. So it is understandable why there's a more lenient policy towards it. And the US sits at a permissive end, which is really the benchmark against which France's ban looks so much more restrictive. There's simply no global consensus on how to classify something that's neither a cigarette nor a vape because it's such a new product. Now, the health concerns. We all know the health concerns regarding tobacco and nicotine, but nicotine dependence is real regardless of the delivery method. We're seeing reports of elevated heart rate and blood pressure, oral irritation, gum recession, and flagged still developing concerns about adolescent brain development. They're probably less toxic than cigarettes, but how they compare to smokeless tobacco is still genuinely contested. And I'd underline again, a meaningful share of this evidence based is also industry funded. So it's very important that we have public funded studies to have a completely neutral view of what is going on. Yes, and advocacy and public health response. On the advocacy side, several groups have been active. Um, Month has documented ONP availability and pushed for stronger oversight. Tobacco Monitor filed the original complaint that led to Tamil Nadu's alert and then petitioned other states to follow. Mothers Against Vaping made a formal representation to the Ministry of Health and CDSCO in 2025 calling for a ban on flavored pouches and gums as they add to the appeal. And I'll note that Sipher and the Resource Center for Tobacco Control, PGI, have also been doing our part through youth campaigns and sessions like this one, including webinars and seminars. So now I'll hand it over to Sir. So you're muted. So you're still muted.
Can you just write down on what does the MANT stand for? The acronym MANT. Or maybe later. It's okay. So next slide, please. So the recommendations are that the online sale of oral nicotine pouches in India currently operates within a highly contested regulatory environment. It is contested by the ONP, industry, and not contested by the public health people. 3 states in India have outrightly prohibited the sale or manufacture of the ONPs under the available legislations, as told by Tusha. And most SUTs may follow suit, and the government of India must regulate ONP consumption, availability, and marketing nationwide, as done in the case of electronic cigarettes under PICA 2019. And I've already told Dr. Ravinder to help in in a draft circular, in drafting a circular or notification which may be issued by all the states and UTs. I think within this week we'll be doing that also. Next, please. There should be stricter enforcement of the available provisions of law, like the Drug and Cosmetic Act, like Food Safety Standard Act of India, Poisons Act, then BNS. So these should be strictly enforced by the people who are responsible for it. There should be stricter action by the Ministry of Electronics and Information Technology and state duty cyber cells against the online sale of ONPs. A simple awareness notice that is enough to stop the sale of ONPs. So this is my experience as a SNO in Punjab, that for electronic cigarettes, we just issued an awareness notice and then it was stopped. And we need to strengthen the e-commerce and the social media monitoring, address direct-to-consumer shipments, misclassified as personal imports and influencer-driven promotion, both identified as key distribution channels in India, and establish the dedicated youth surveillance. No mechanism currently tracks ONP awareness, use, or susceptibility among the Indian adolescents and the young adults. A priority underscored by international evidence of youth appeal and misconception. And then there need to be a coordinated national response informed by the rapidly growing international evidence base rather than industry marketing claims alone, will be essential to address the growing availability and the promotion of ONPs in India. before usage patterns they become entrenched. So we need to act very fast actually. Next, please. So what are the carry home messages? Basically, the key points are ONPs they considered as a regulatory blind spot in India, but luckily for us that in India there are already regulations uh, which are provision for to act against the availability of the ONPs. Then online and social media sales are expanding faster than regulatory oversight. The evidence base is real but thin for India and partly industry funded. And there should be a coordinated national response before usage patterns they become entrenched. Next, please. So these are the notifications or the circulars issued by Dr. Ravinder as SNO. But he got this issued from the FDA. So will you be talking about this, Dr. Ravinder? How you went about it?
Definitely. So,
Okay.
afterward, once you
So
complete
next,
your presentation.
okay. So next, please. So this is the continuity of the notification by HP Himachal Pradesh government. Next, please. So this is by the Haryana government. Next, please. The state drug controller that issued this. Then this is a Tamil Nadu government notification of the circular. Next, please. Next, this is continuity. And Tobacco Monitor, which is an CSO, they sent this to all the SNOs or even all the state drug controllers in India, and action has been taken, at least in Haryana, we know about. Next, please. So these are the sites, online sites where the drugs are available. Fisha, I told you that there are more than 10 sites actually from where
Yes,
you can get it, huh? And
yes,
you just note down the quantity also. So I think that will be more useful.
yes, it'll
And
definitely make
I may just let you know that what is the difference between the nicotine replacement therapy, which is legal product, the nicotine gums and the nicotine lozenges. The difference is that the content is as high as 100 milligram in the nicotine pouches, oral nicotine pouches, and they're flavored products. Gums are not flavored. Gums or lozenges, they are not flavored, but oral nicotine pouches are flavored. That is why the youth they are attracted to it. Next, please. Next, 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 next. So these are all the products which are available online. Next, please. So these you can refer to these references also, the studies also. So we have the subject expert, Dr. Ravinder Kumar. So he's MBBS MPH from PJ Chandigarh, and he's a graduate certificate in global tobacco control, Baltimore, and we were actually batchmates in that. But it was 2012, isn't it? The leadership training program. So this is separate from that, isn't it? And presently, he is State Nodal Officer for Tobacco Control, National Health Mission, Himachal Pradesh. And previous position is that medical consultant, WHO NTP, Network India. And then he was also technical officer in Tobacco Control, the Union Southeast Asia office. So over to Dr. Ravinder, please. Yeah. Dr. Ravinder, you may just let us know how you went about the notification.
Right. Thank you so much. Thank you very much to the organizer for inviting me for this important webinar.
You can just
Uh,
remove the slide, please. Yeah.
okay.
Hmm.
Right, sir. So I tell you how it started basically. For almost 6 months in the Instagram post, I was actually going through about this oral nicotine pouch. It was something surprising to me because we were saying, I mean, we were looking for that how to implement this backup ban over electronic cigarettes. Then somehow I came to some Instagram post where I could find this coolement, this product basically, and it is made by one of the Indian manufacturer only. So in one of the presentation, I could not find the manufacturer of this. This is very common in India, by the way. It is Mohan food product. It is a Mohan food product, and it is New Delhi based. You can check in the website itself. So this manufacturer makes about say 50 products, and many brands of oral nicotine pouch. At the very same
Can you
time,
show us the pouches actually?
okay, I can show the pouches. So basically, it is very pungent. By the way, it's very difficult to, a normal person cannot see. So this is the pouch. This is very small. This is discreet. This is flavored. This is mint flavored basically, and it is having 10 milligram nicotine. And so okay, so it started with that only, and at the very same time, what I did, I when I opened this Mohan food product website, then eventually one this WhatsApp number popped out, and then the discussion started with the seller basically. So I became a decoy customer, and then I purchased this. The striking point is basically they don't ask you for the age basically. So they don't verify your age. So it's why my question to Tuishna basically. So you had done wonderful study when you open these websites. So could you find the age restriction there? Because I also searched many websites, at least international websites. They ask you whether you are whether you are minor, what is your age, if you are less than 18, so please exit, something like that. But it was not there with this product basically.
100%,
So
sir.
yeah, so I could purchase this, and then at the same time, our government received this application or communication from tobacco monitor Mr. Cyril, and then because I'm a state nodal officer, so that file finally came to me for my comments. Then I went through in depth, and then I found that there is no need for a newer legislation. We are having food safety standard of act of India, where 2.3.4 of 2011 rules says that no food product can have nicotine and tobacco in that. And because they are having menthol, they are having watermelon, so I'm having another product. So this is basically Nick Switch. So this I bought from Kolkata. I was there last month only. It was very common over there, by the way. So it is having watermelon. So basically, these are food products. So it's very easily it can be regulated under 2.3.4. And at the same time, if you see Drug and Cosmetic Act, so Section 3B basically it is a section which actually approves any product as a drug, but it doesn't qualify as a drug because under Section 2, the company or the manufacturing unit has to be first get recognized basically. It has to be first approved. So it defies both laws basically. So that is how we made this proposal, and finally it went to the highest authority. It was examined, and then on in the month of May, government came out with the notification that it cannot be sold, it cannot be stored, it cannot be manufactured in the jurisdiction of Himachal Pradesh. So the problem right now with me is that it is not physically available. So it's not physically available. We are going doing the surveillance across all shops, but it was not there. Although we are not denying that it is not available in an online platform, it must be available. But for that also we have to plan some SOP, how to enforce this. So I stop here for some time, and then if there are questions, then I'll take one by one. Over to you, Dr. Gupta. Thank you.
Yeah. So what was the process you actually undertook? Uh, I mean, you told in brief actually, no? How the Tamil Nadu people they did it, and how the Haryana people they just sent a message, sent a circular from the state drug controller uh, to the drug control officers, and then it was actually implemented. So, what was exactly the process you followed?
The two things, sir, in our state, actually, it is not state drug controller basically. So, frankly speaking, what happened? There was a communication from tobacco monitor to our secretary health, and I'm sure this kind of communication must be to each and every state.
Yeah,
By the way,
it went to Haryana also. Yeah.
it went to Haryana as well. So when this communication, because I'm a state nodal officer, that file came back to me for my comments. Then I analyzed this. What is this product actually? But before that, I was having this product with me, so I was having little bit idea of about its constituents, and also that it is not regulated at all. Then I gave my inputs in that file only, and where I said that no, it can be regulated under Food Safety Standard Act of India 2006 rule and Regulation 2.3.4 because because it is having menthol basically. It is having additives. It is having uh, uh, spices or flavors or something like that.
Yeah.
So then finally it went to our government, where there were the there were it was examined at the highest level, and then from secretary health basically,
Mhm.
the that kind of a uh, regulatory notification was issued. It was issued to the state drug controller and drug inspector network to take action under Drug and Cosmetic Act, and also to the food safety officers to take action under through 2.3.4 of the Food Safety Act, sir.
Yeah.
So it is not the uh, no, new notification. I mean, it is it is it is not a novel kind of a thing. Existing legislation, we are just
Yeah. Yeah. Yeah.
you know
Yeah. Yeah. That is good thing about India, that we already have some provisions in the law. Yeah. Can you just show us the word file, and then we can add in the we can draft the model circular or a notification.
So what file I will be sharing with you, sir. So probably it will be difficult
Now
for
you can't
me.
show. Okay, it's
I
all right.
can show basically, but I think let me try. I mean, if I can,
Yes, if it is possible, you can just let us know.
just a minute, sir.
Mhm. It's okay if you share with me. I can just
Uh,
give my inputs, and then I
no
actually
problem, sir.
we can have a consultation with the state nodal officers of Himachal Pradesh,
Okay,
uh, Tamil Nadu, Haryana, and the drug control, the and what is that called? Joint Commissioner drugs, no? In
joint.
most states.
Every state are having different nomenclature, sir.
Okay, okay. So we can
So
call the earlier it was called a state drug controller. So we can call
mhm,
them also, and then we can call some people who are expert in laws, like Dr. Asta and Ranjit. Also, we can call Amit. We can call, and we
mhm,
can have a consultation. Yeah.
mhm. So basically, this was the kind of a press note where it is written that it has been observed that oral nicotine pouch are being sold and delivered through online platform informal channels within the state despite
Hey, was it the press note or was it a circular?
notifications, sir, circular.
This is a
At
notification.
this administrative order
Acha,
shall
by the Secretary
take
Health.
no. So it was we proposed by Secretary Health, but Secretary Health approved the file, and
It's okay. No, no, it's
then
the same thing.
directed Director Health Safety Regulation to issue it basically.
Yeah, yeah, yeah.
So it was
That
the
is
draft
equally
basically.
good. Yeah. Mhm.
Yeah. So here it was written, by the way, State Drug Controller directed to initiate immediate enforcement under Section 18C, and
Mhm.
designated officer and food safety officer shall enforce through 2.3.4.
Acha, can we add that the BNS also in this, the Poison Act?
Sir, so depends, sir, because the Poison Act is there only in 4 or 5 states. At least
Yeah,
it
yeah.
was not there in our state, na. So there will
Mhm.
be limitations. The states which are having
Yeah,
Poison
but the
Act, like
BNS is there
Karnataka,
in your state as well.
the BNS is pan India, sir.
Okay, BNS we can
So
write.
BNS we can write. So we
I
need to
can
take
just
legal
give my
opinion.
inputs. I can give my inputs and then share with you and all other people in the webinar, and then we can have a consultation under Cipher also.
Yes, sir. One of the
Okay.
most important thing which we actually did in our state after getting this kind of a notification, we had the this warning notice in the newspaper basically,
Awareness
social
notice.
media also. So
Awareness.
we made everybody clear that so this cannot be sold in the state of Himachal Pradesh.
Do you
So
have
that is
that
important
circular also?
basically.
That the
Yes, it
press
is there. It's
awareness
there.
notice also.
It is
You
there. I will
have that?
share that also.
Okay, okay.
I'll share that also.
Hmm. I think it is urgently required that most of the states they issue this notification or the circular, and then it can be done pan India also by the government of India.
So one of the important thing, Dr. Gupta, I think is basically if anyone find this product, say supposingly you find in Chandigarh. So what
Mhm.
I will be requesting the authority in Chandigarh to take this action simultaneously under food safety as well as drug, because I tell you what will happen. Say they will say, sir, uh, we are nowhere claiming that this is a drug. You
Mhm.
know, they can claim actually because they because this concentration is not approved.
Right.
the concentration of nicotine as a drug is approved only 2 milligram over the counter and 4 milligram on the prescription of the doctor. I'm
Oh,
having this product 6 milligram. There, the products are having concentration as high as 120 milligram as well, 80
yeah,
milligram, 50 milligram. So then they will say, sir, this is the lifestyle product, sir. Then
yeah.
comes the Food Safety Standard Act of India.
Hmm.
They will say, gentlemen, you cannot sell any food product which is having nicotine in it.
Yeah, yeah.
Then we will regulate you under 2.3.4. So
Hmm.
they will land nowhere basically.
Yeah,
So
yeah.
that is why, I mean, simultaneously, basically the FDA is the main regulator through drug or through
Through
food safety
food.
rules.
Yeah, yeah. Because MD, NHM, or the commissioner drug, that they are meant for food as well as for the drugs.
Yes, sir.
The
Yes,
commissioner
sir.
FDA. The commissioner FDA.
Commissioner FDA. Yes,
Yeah.
that's right.
Right. So Shifa, do you have any questions?
No, sir. As of now, we haven't received any question.
Okay. We'll be, Dr. Ravinder, we'll be sharing some questions if they just come to us, and then we'll be sharing with you in the mail, and we'll seek answers from you also. And in the meantime,
Okay.
you can just share the Word file with us, and we'll give our inputs, and then we'll have a webinar or the consultation. Right.
Okay. That will be fine, sir.
So I think this is all. This is all. Or Trisha, do you have any questions for Dr. Ravinder?
No, sir, but I'd just like to add that about the Mohan food products, even I've seen when I was doing my research, I saw them quite a lot on India Mart. Like they were, I think, one of the most popular ones. That and Dholakia tobacco
Voila.
in India.
The brand is Voila. So basically, when I ordered this, the packaging was very attractive. A green color and minty and something like that. But when I received this packet, because surprisingly, when I was talking to them, they said, sir, uh, which concentration you want basically 6 milligram, 10 milligram, 20 milligram. So I said, I mean, you are not having ready made with you. He said, we have everything. I mean, you just ask, I mean, which concentration you want. So then I said, okay, give me 10 milligram. So they are having Voila, wintergreen or white or so many brands
Yes,
basically
wintergreen
they are
also.
having. It is
Yes.
New Delhi based, and you just give the order and
Dr. Ravinder, what was the cost of the pouches available in?
so I got this for 500 rupees and
How many
150
how
is
many
courier
pouches are there?
charges.
How
20,
many?
20.
20. So it is basically 25 rupees a pouch.
It can have any cost. So in Bangalore, it is available for 1200 rupees. 1200 rupees. This one.
Oh, okay.
So because there is no regulation, you can vouch and you can ask any amount from these people basically. So
Hmm.
one of the thing which when I was going through literature search, I found almost every manufacturer are having 20 pouch as a standard unit.
Standard uniform.
Mostly,
Hmm.
mostly 20. I haven't seen any. I mean,
Yeah, are they available in tin pouches also?
I
The
signed.
tins.
So I signed this only.
Okay.
This type of
So 20
only.
pouches is the standard,
Probably
standardized.
because I think the hub of this thing, I think it all started from Sweden,
Hmm.
and most of them they say basically this product is also from Sweden, this Nick switch. So I have many Instagram videos where there are having big showrooms basically. Different kind of sunas are available as a showroom in a Sweden,
Yeah,
as
yeah.
per this Instagram post. And unfortunately, I visited Calcutta. I mean, almost a 1 month back, where it was basically showcased in a showroom also. Big
Okay.
shops were directly showcased
It
in
was
the
available physically also. No?
physically available. I could see many brands over there. So regulation is the issue basically,
Hmm.
and unfortunately, many of the makers of them, they are claiming that it is harm reduction product basically, and it may help in tobacco cessation, but actually it will not. So the
Basically,
fact,
it is supplementation and not a substitution of nicotine.
I would say otherwise also, sir,
Hmm.
because this is so catchy and attractive, anybody will start with this because it is having very good flavors basically. So once you are hooked to nicotine, it hardly
Yeah.
matters that you continue with this costly item. You
And
have
as
to.
Fisher study that says that 17% of the youth in US even, they think that it doesn't contain nicotine.
No, but at least they are writing. They are honest in saying that. They are
Uh-huh.
saying that it is highly addictive. Nicotine is highly addictive.
Uh-huh.
Not at least this one, because it was totally locally made. But this is having nicotine is highly addictive. I
Because
can read
they
out.
write in US, they write it is tobacco free. So tobacco free, some people they think that it is nicotine free also.
So might be. I mean, they have clear warning where they say this product contains nicotine, which is a highly addictive chemical.
Mhm.
So I've seen many of these products in one of the workshop where at least the imported products they are writing clearly
Okay.
about the nicotine content,
So
and
this is directly imported.
this is imported, sir.
Okay.
This is imported.
And
Uh,
did you get hold of the Indian brands also?
yes, this is Indian brand, sir. The other one is Indian brand.
Which?
I have I'm right now having some discussion with the department. We as a decoy customer, there is one Telangana based this oral nicotine pouch manufacturer. So maybe after some times we have more information to share with you. There is a local manufacturer in Hyderabad also, and they are saying that we are Indian manufacturer and our product is good, and uh, so it's a made in India product basically. So
Okay.
very soon you will listen more from our side.
Those Dholkia manufacturers, they are
No,
producing in India.
that's not Dholkia. Dholkia is probably in Gujarat or Rajasthan probably, but ये मैं कुछ और है. This is
अच्छा तमिलनाडु में
no, Telangana.
तेलंगाना हाँ, sorry.
Telangana. So actually one of the problem in the enforcement will be establishing the linkage. That will be very difficult. I tell you how. Supposingly there is a manufacturer, say Bajaro, you show Bajaro. I have seen many products of Bajaro also. So supposingly I place the order.
Mhm.
Bajaro person will basically send that product through a courier.
Okay.
That reaches Shimla supposingly. From Shimla, say it is a for that matter any courier company. The boy will reach out to my office and he will hand over that product to me. So the first case or first person who will be caught will be that poor courier boy. Then he will say, "Sir, I work for this company." So courier companies. The second person will be that courier company, Shimla branch. Then they will say, "Sir, it came from the main branch of New Delhi courier." Then third person. Then fourth person who gave that. So it will be very very difficult. At each level, that linkage and establishment, it has to be made in the court of the law.
So that is another problem here.
That is another problem, and I
तो
think the
इसका क्या
best.
हल है क्या?
So
How can we go about it?
no, but even then it will be done, sir. So my food safety officer, they are very very learned person, and who has done this code pass section 5 and 7 way back in 2013 and 14.
ये कौन है?
They are
Who is the food safety officer?
Mr. LD Thakur, Mr. Leela Thakur. Now he is Assistant Commissioner of Food basically. So
अच्छा
he is the man basically who's technically very sound, and he knows actually how to deal such cases.
So you can call him also for that consultation. No?
No, sure. But so I hope before that we will have that case matured. So
Mhm.
we are actually doing this, and hopefully very soon we'll get good
So in
breakthrough in this case.
addition to that notification, you just share with me the awareness notice also.
Yes,
Then we can start with the process of holding that webinar or the consultation.
correct.
So Shifa, you can just go ahead with the formal vote of thanks, and then we can end the session.
Yes, sir. Thank you so much for a deep explanation. On behalf, as we conclude today's session, on behalf of entire Doplex's team and on behalf of viewers, I really thanks to all our esteemed member here, Dr. Ravinder, Kumar, Dr. Rakesh Gupta, and Ms. Tuisha Mahajan for sharing an insightful and evidence-based presentation on such an important topic, oral nicotine pouches in India, a review of online availability, marketing, public health, and regulatory issues. And I also like to extend our sincere thanks to all our participants for joining us today. for your active participation throughout the session. So on behalf of Doplexis, thank you once again for being a part of this educational initiative. We look forward to welcoming you all again on our upcoming webinar. So thank you everyone. Have a great day ahead.
Thank you all. Thank you all.